What is public health and what has public health accomplished? If you are asked that question by someone on the street, what would you say? Today, we would like to skip through North Dakota history, pulling one major accomplishment from each decade as a way of illustrating that the health of North Dakotans has always been and will remain dependent on a strong public health infrastructure.
Public health in North Dakota preceded everything. We had public health before we had hospitals. We had a public health officer before we were even a state. We had public health services, a congressional appropriation to purchase smallpox vaccines for American Indians in 1832, 57 years before we were even a state in 1889. This is because public health, like public education, is essential to a flourishing society. As you follow our story, imagine the impacts of these historical accomplishments on our lives today.
The 1880s. In the face of diphtheria epidemics devastating children and families, diphtheria antitoxin reduced the case fatality rate from 44% to 18%.
The 1890s. The state hospital was established to provide safe care to people suffering from mental illness. This was 60 years before the breakthrough antipsychotic medication chlorpromazine was created.
In the 1990s, we had the Pure Food and Drug Law. North Dakotians were suffering from adulterated food and medications dumped on them from out-of-state companies. Chemist and NDSU professor Edwin Ladd used his lab to prove it, leading to some of the first food and drug laws in the country.
1910s. The advent of collecting all births and deaths allowed for scientific evaluation of causes of death, in particular maternal and infant and maternal deaths. Over 10 years, State Health Officer Dr. Maso Williams cut maternal mortality in half by the use of data.
1920s. 1925, the Fargo Child Health Demonstration Project, knowing the causes of disease and death, allowed public health leaders to design interventions to prevent them. The Fargo Child Health Demonstration Project was one of four such demonstration projects in the country. It led to the elimination of the smallpox and a reduction of the Fargo infant mortality rate by half.
In the 1930s, there was the 1935 North Dakota Title V Maternal and Child Health Program. As I said, it was established in 1935 under the Social Security Act. North Dakota's Title V Maternal and Child Health Program is the nation's oldest federal-state partnership in this field. Among the many initiatives, vitamin D enriched milk reduced rickets in children.
1940s. We had the 1941 health districts formed. In 1941, North Dakota established 12 health districts with an average of 53,000 people and a requirement of one public health nurse for every 5,000 people. This led to organized public health efforts, including garbage collection, food service inspection, safe drinking water, and mosquito abatement.
In 1954, Salk polio vaccine trials. Polio was endemic throughout the first half of the 20th century, leading to death and permanent disability. In 1954, North Dakota was a Salk polio vaccine trial state. Within 7 years, wild polio was eliminated.
The 1960s. The State Division of Chronic Disease was established in 1964. The blood pressure medication, propranolol, was designed in 1962. The combination of pharmacological and behavioral options for cardiovascular disease prevention drove heart disease mortality from a peak in 1960 to half by 2010.
1970s. In 1974, a network of deep fresh rural water systems was established after reliance on low-quality well water and cistern water. This included treatment and fluoridation of rural water.
In the 1980s, we had the North Dakota Clean Indoor Act. Legislative measures such as the North Dakota Clean Indoor Air Act in 1987 created smoke-free environments in public spaces like restaurants and workplaces. Packets of cigarettes smoked per capita declined by 48% from 1980 to 2020.
1990s, 1996 Women's Way Cancer Funding. In 1996, North Dakota was awarded breast and cervical cancer funding from the CDC called Women's Way. The Women's Way program has screened over 15,000 women with 323 breast cancers and 3,241 cervical cancers detected.
2003 West Nile virus. Emerging infectious diseases rarely seen in the upper Great Plains emerged with the first West Nile virus epidemic in 2003. Measures including use of insect repellents, avoiding the outdoors at dusk for elderly persons, and vector control have brought case number down.
In 2010's decade, we've focused on opioid response. Starting with STR funding in 2017 and increasing ever since, North Dakota has developed comprehensive community-based approaches to preventing and mitigating opioid-related harm, including safe prescribing, naloxone distribution, stigma reduction, screening, and syringe service programs, resulting in a decline in 2023.
In the 2020s, we have the 2026 new state laboratory. First established in 1907, the state lab in Grand Forks brought chemistry and technology to bear to protect North Dakotans through testing of water, sewage, blood, urine, and throat cultures. North Dakota is now constructing a $70 million state laboratory on the Capitol grounds in Bismarck.
I hope you have seen the role public health has played in building a healthy North Dakota in the past. Now, we would like to cast a vision for our public health of the future by calling out some of the great public health needs.
Evidence-based public health relying on surveillance, disease reporting, and population health informatics.
Infectious disease control, including hepatitis C, HIV, and syphilis.
Environmental health challenges such as air quality, plastic waste, warming environment, radon, lead poisoning.
Also, improved occupational health, including workplace safety.
Policy measures to reduce substance use disorders, including binge drinking, methamphetamine, and then opioid use.
Collaboration of local public health with FQHCs, quality healthcare, long-term care, faith communities, schools, corrections, etc.
The new generation of public health leaders willing to serve as the public health strategist.
Physical activity and healthy foods such as Strong Towns Fargo Project, farmers markets, and community gardens.
Healthy aging, such as the Stepping on the program.
On behalf of the NDSU Public Health Association, we appreciate the opportunity to attend your board meeting. And we hope that our walk through North Dakota Public Health as history has kindled the flame of pride and confidence in public health in North Dakota. As public health students, we are looking for opportunities to do internships in local public health units in North Dakota. Please consider us when you plan your work.
Finally, we hope that our vision for the future inspires you to recommit yourself to the mission and calling of public health. It is our desire to seek employment in public health, and we seek your guidance as we move ahead professionally. We are your firm supporters and allies, and we are determined to reframe the public narrative about public health in North Dakota. Please feel free to also look at that brochure that is in your packet. It also goes through what we've discussed here today. Again, we are here to be your allies, and we are the future of public health. Thank you.
Public